Well, thank you all very much. I appreciate everyone taking a few minutes out of their time to join our COVID-19 memorial service. We thought it was important that we get together and reflect on the impacts of COVID-19 on many different constituents in our organization. So today we're going to have a brief service where I'll give some remarks. Chaplain Gladys Hubbard is going to say a prayer in our memorial. We're going to talk about a new plaque that we're unveiling here at Johnston-Willis Hospital. And then we're going to have a ceremony where we release butterflies as a symbol of hope to come for the future. So let me just start with a few remarks thinking about our COVID-19 experience here in Richmond, here at Johnston-Willis Hospital. Our mission here at the hospital is, above all else, we are committed to the care and improvement of human life. Around this time last year, we really got called in a special way to bring that mission forward for our community. Our mission is why we exist. We exist to improve lives, and we really have done that in a tremendous way during this COVID-19 pandemic. The first group I want to recognize is our patients. And I'm sure every single one of us out here in this courtyard today can think of many patients that we've cared for in our organization. It takes many hands to care for one patient. We met amazing people along the way. Many of those we were able to get home, back to their family, back to their loved ones, back to their work, back to their churches, back to their communities. Sadly, many of those also passed away under our care. And we think of those patients every single day, and we think of the impacts that they've had on other people's lives and the impact they've had on our lives. We also think about their family, right? So during the height of COVID and to this day, we've had to restrict visitation in our hospitals. That means patients going through the most stressful, life-threatening event possible have had to do that without their support network. They've had to do it without the people that they love for and trust and care for, that advocate for them, that are special to them. And we've had to take on that role. We wish wholeheartedly that we could have had their support network here in the hospital, and we did everything we could to make that safe for them. But there was just sacrifices we had to make in that regard. So for all the people that have been, all the family members of our patients that have been impacted, we think of you as well. Perhaps most importantly, we think of our care team. So that's all of us standing around this room, or around this courtyard. The physical toll, the risk to our individual safety, the psychological effects that this caring for everyone has had on everyone is really immeasurable, right? And I don't know that we're gonna know the impact of it for a long time to come. So we are seeing it manifest now, and people are tired. People are experiencing burnout. Their well-being is suffering. Their relationships may be altered with people that they love. And we cannot thank enough the care team that answered the call to duty, that, as we say in HCA, we showed up. We showed up, we were resilient, we faced the challenge head on, we didn't back down, we came in every single day and did our best to care for our patients. So thank you all for being a part of that care team. On behalf of our patients and our community, thank you for that. We also think about our families, right? So we talked about our patients' families. Think of the impact that this has had on our families, right? So they've seen us come to work and worried about our safety. They've seen us come home crying, thinking about situations that we've had to face with at work. They've had to do without us because the demands of work have been greater in many situations. So for the toll that this has had on our families and your families, we thank you from the bottom of our hearts. It's really difficult for me as a father of three young children to come home and get asked every night, how many COVID patients do you have at the hospital? Now recently, it's been great because one of my twins, Peyton, who's Dr. Cheatham's favorite artist, will give me one of these or a fist bump when our numbers have started to really come down, because she knows that means there's less people getting sick and there's less demands on your time and less demands on your safety. But it's had an impact, right? So we understand that and we appreciate that. So please thank your family members on our behalf. for all that they've been through to support you so that we could take great care of our patients. I'll never forget when we started this journey, we had a phone call with our corporation, with our CEO, Sam Hazen, and he laid out 4 objectives for addressing the pandemic. That first one was, we're going to keep each other safe, right? So safety was the first priority. That meant our staff members, our physicians, our families. That was our number one mission. Don't do anything else until you address that. The second objective was, we're going to take great care of our patients. And think of the treatment modalities that we were able to bring to our patients, how quickly we were able to bring therapies, how we trialed different therapeutics very quickly. We adapted with PPE, we adapted with different processes to care for people. So I feel like we did a really good job of meeting that objective. Third, he said, we're going to learn from each other. So we're going to learn from experiences in this part of the company and that part of the company. We're going to share best practices with one another, because this isn't 190 different hospitals responding to a pandemic. This is the world's greatest healthcare company coming together to respond to a pandemic, and we have to act that way. And finally, he said, we're going to be stronger because of this. So that was the fourth objective. So as hard as that is to see right now, there's things that we've learned through this pandemic that are making us stronger going forward. We've had to find new ways to communicate with each other. We've had to find new ways to communicate with our patients. We've had to find new ways to communicate with our community who's not interacting with us in the same way that they did before. We've had to find new ways to care for people, right? So we've had to come up with new treatments. We had to come up with new processes. I think we've all done a better job of not getting sick, right? So we're not getting the flu like we used to. We're not getting the seasonal cold like we used to. So we're learning things. We've learned things that are making us stronger. I'll also never forget a phone call we had with our Division Chief Medical Officer, Dr. Jake O'Shea, very early on. And that was back when we thought, maybe I'll say not we, but I thought, hey, 3-4 months down the road, we'll have this under control, life will be back to normal, right? So at that time, he said, this is a marathon, not a sprint, right? And I've given up thinking where we are on that marathon. I'm not a marathon runner, just full disclosure. I've read about marathons and the different walls that you hit, and then you step up and you hit a wall and then you get another wind and you keep going. So I'm hopeful, and the data suggests that we're nearing the end of our marathon, but we can't stop running, right? We still have to meet those same objectives. We have to take care of one another and keep each other safe. We have to provide great care for our patients. We have to keep learning from each other, and we have to just make ourselves better, right? So the demands of this phase of the pandemic response are a lot different than they were in the beginning, right? We have all the PPE that we need. We have all the medicines and therapeutics that we need. We have vaccines that are making our community safer. We have the tools, right? Right now we're in the rebuilding phase. So we're rebuilding the staff in our organization. We're rebuilding the number of people that we have at the bedside caring for one another. We also need to rebuild our well-being, right? So we need to find those tools and tactics that are going to make us stronger mentally and help us get over the fatigue that we're all experiencing. So that's where we are in the pandemic response. So let me just wrap up. That was a lot longer than I planned to talk, but you can tell I'm obviously very passionate about what we've achieved as an organization. I'm very passionate about the fact that so many of you have come down to take a moment of reflection to think about our patients, their family members, our teammates and our family, our community in general. So thank you for doing that. So now I'm going to turn it over to Chaplain Gladys Hubbard, who's going to give us a prayer on behalf of our COVID memorial service.
As I look around at everyone today, I think about, as I go around the units, the teamwork, the love, support that you give. And as I see that in your eyes and your face, I try to work to comfort you and to do as much as I can. But let's continue that journey, as Zach has said. Let us pray. Gracious God, we thank you for this gathering today. The memorial service for our COVID-19 God, you know the habit and the things that we've gone through. And I ask right now, God, that you revive us. Give us that strength that we need to continue this journey, because it's not over yet. God, bless our team. God, you know all the hearts and minds and soul standing in this group, the teamwork and to working together, giving love and patience to all our customers and families and patients. For God, you know what they've gone through. Lord, strength, give them that strength that they need. Help the leaders, God, with their goals and their efforts that they have for this hospital. Bless them, God, that they've come up with a mission that is far above, and really the team is meeting that goal. God, bless the doctors and the nurses and all the medical staff. Help them, God, show them the healing acts that they can perform. Bless the case workers and the social workers, EVS, and everyone in this group who have participated to the max. Bless each and every one, God, and let them know that you, God, are the one that they can look to. Bless those, God, that have lost loved ones. Bless them, God, and let them be seen as a crowd of witnesses that we can really be thankful for. The ones that we love and that's no longer there. And God, as you give us strength, as we go through this day and this journey, we give you glory and honor. And we thank you. Amen.
Thank you, Chaplain. That was beautiful. Thank you for your words. So now Suzanne is going to read the plaque that we have developed, or that we've put here in the courtyard to remember this time going forward.
I'll take this. Sorry. Thank you all so much for being here. I echo the sentiments of Zach. Your passion, love, and support has gotten us through this far on the journey. We have the hope for tomorrow. So we're just so thankful for everything that this team has done over the past year and 3 months. It is the marathon, but I know this team, with the love and support and passion that you have, we will get there. We have hope. In March 2020, our lives changed forever as we began to fight the COVID-19 pandemic. Our teams have fought with courage and compassion, and not without tears and exhaustion. We recognize each and every member of our Chippenham and Johnston-Willis team who have proclaimed that we will never quit. We will always put our patients first, and we will never stop caring like family. For those who lost their lives to the virus and their families, you are forever in our hearts.
So that plaque is located here, so please take a look at that on your way out if you haven't already seen it. So now we're going to have a symbolic event to honor our COVID-19 memorial. And this was a suggestion by one of our teammates here at the hospital, Dana Hubbard, who in her family tradition, they released butterflies as a symbol of hope and a symbol of things getting better. So Stephanie Stratton, our Associate Chief Nursing Officer, is going to read a few words about the symbolism behind releasing butterflies, and then our team here is going to release those into the world.
Thank you all for coming. All butterflies fly. That makes them symbols of joy, pleasure, ease, and freedom. All butterflies are beautiful. That makes them symbols of beauty. All butterflies go through a complete metamorphosis with the 4 stages of egg, caterpillar, pupa, and finally winged adult. That makes them symbols of transformation, sometimes resurrection or reincarnation. All healthy butterflies rise up and fly away when released. Their upward movement symbolizes hope for the future. That one's taking up residence on my finger.
Well, thank you again, everyone, for joining the memorial service today. Thank you for taking a minute to think about all of our constituents in this journey.